Hi everyone, my name is Khan and this is my presentation on vitamin D. So this is the chemical formula for vitamin D, which is C subscript 27, H subscript 44, and O, which are carbon, hydrogen, and oxygen. Those are the elements that make up vitamin D. The molar mass for vitamin D is 384.6 AMU. Its structure has single and double bonds, and vitamin D is nonpolar. It is one out of four lipid soluble vitamins, so it is insoluble in water. Vitamin D appears as a fine white odorless crystal or powder. It has a melting point of 183 to 185 degrees Fahrenheit. Vitamin D oxidizes when exposed to light and moisture in the air. So now we're going to talk about the function and metabolism of vitamin D. The function of vitamin D is that it supports our immune health. It also supports our bone, teeth, and muscle health. The parathyroid gland uses parathyroid hormone to signal vitamin D activation in the kidneys. Vitamin D helps the body absorb and retain calcium and phosphorus. Rich vitamin D diet um, can be a way of getting vitamin D, but the primary source is from the sunlight. How does this process work? The UV light we get from the sun is the first step in the synthesis of a precursor that gets converted into an active vitamin D. UV light comes in contact with our skin, and that triggers a conversion of cholesterol in our epidermis called 7-dehydrocholesterol. This process makes cholecalciferol, which is an inactive state of vitamin D in the blood. Our blood gets to the liver, and that cholecalciferol, which is known as vitamin D3, comes in contact with an enzyme called 25-hydroxylase and turns vitamin D3 into 25-hydroxycholesterol, which is calcifediol. The next process is in the kidneys, where the calcifediol comes across another enzyme called 1-alpha hydroxylase, creating a molecule called 1,25-hydroxycholesterol, which is an active form of vitamin D. This chemical reaction is a synthesis reaction, and this reaction is an endothermic reaction. So let's talk about disease state when there's too much vitamin D. Vitamin D, the standard range for that is 30 to 100 ng per ml. Too much vitamin D is levels above 100 ng over ml, and vitamin D toxicity is called hypervitaminosis D. It can cause damage to the kidneys, soft tissues, and bones. Symptoms of vitamin D toxicities are constipation, irritability, high blood pressure, muscle weakness, increased urination, dehydration, fatigue, confusion, and excessive thirst. So low vitamin D is more common than vitamin D toxicity. So let's talk about the disease state when there's too little vitamin D. A very critical level is below 10 ng per ml. Low levels of vitamin D can cause rickets in children and osteomalacia in adults. Rickets are the softening and weakening bones in children. Symptoms of rickets are delayed growth and motor skills, muscle weakness, skeletal deformities, and pain in the spine, pelvis, and legs. Osteomalacia is soft bones and weak bones in adults. Symptoms of osteomalacia are painful joints, muscle pain, bones that easily break, difficulty walking, muscle cramps, pin and needle sensation, and stiff muscles. So, how do medical professionals diagnose these problems? They run blood tests to check vitamin D levels, alkaline phosphate levels, and PTH hormones, which is parathyroid hormones, to detect vitamin C and phosphate levels. They can also do x rays of the bones in children and a DEXA bone density screening in adults. In this image you see here on the left is a normal um, x ray of an adult. It looks like the hip bone. And then on the right, you see there is a pseudofracture, which is a flaw in the bone that is similar to that of an appearance of a real fracture. And this is a common sign that contributes to the diagnosis of osteomalacia. So on this slide, you see some symptoms of rickets and osteomalacia. Some signs of rickets in children are stunted growth, odd-shaped skull, spine deformities, pelvic deformities, and they have like a wide ankle joints, wide knee joints, and odd-shaped ribs. They have an appearance of a pigeon chest and wide elbow joints and wide wrist joints. But the most significant symptoms you would see is the bull legs, which is seen in the x-ray in the middle of a child, and how their lower leg is kind of bent out like forward, pointing outwards, making like a C shape. Instead of it, if it were to be normal, it would be a little bit more straight. And then in the picture you see on the right, you see a normal bone integrity. And then on the bottom, with the rickets and osteomalacia, you would see it's more sparse. The bone integrity it's more weak. So treatment of rickets and osteomalacia would include vitamin D supplementation on a daily basis, treating the underlying cause, such as organs that affect vitamin D activations, which are the liver and the kidneys. Some preventative measures include consuming prenatal vitamins during pregnancy that have vitamin D in them, which most of them do, and vitamin D droplets to neonates and infants. Sunlight helps our bodies make vitamin D, and also taking vitamin D supplementations, which are synthetic form. They do not stimulate the body's own cell to produce it, but instead are activated by the liver and the kidneys. Consuming food rich in calcium and vitamin D helps as well. These medications come in pill or droplet form and is administered by mouth. It may take several months for muscle weakness and bone pain to be relieved. Bone deformities can be corrected by a medical provider. Continuous vitamin D supplementation daily will help prevent the condition from returning.